Good afternoon. Thank you for joining me today. I'm Scott Harris from Public Health. I'm joined on the stage today by Dr. Don Williamson, former State Health Officer and with the Alabama Hospital Association, Mr. Mark Jackson from the Medical Association of the State of Alabama, and Director Brian Hastings of the Alabama Emergency Management Agency. We appreciate you joining us for this update. I wanted to start by giving you a situational update about what's happening with COVID-19 infections around the country and in Alabama. And then I want to talk to you a little bit about new health orders that are being issued by this department today. As you are probably aware by now, we have over 9,000 cases of COVID-19 infection in the United States. There have been over 150 Americans who have died from this disease so far. In Alabama, we have, as of this morning, 68 cases, although fortunately no deaths yet in Alabama. The 68 cases that we have as of 8 o'clock this morning represent more than a 40% increase in the last 24 hours. We're certainly aware that as we are testing more, we are picking up more. It seems as though wherever we look in the state, we are finding cases of infection. We are concerned about the fact that at least half of these cases that we know of have not had any significant travel or certainly not any international travel history. These are patients who either have resided only in Alabama or have perhaps traveled within the United States, but they do not have other obvious risk factors for infection. We believe that we have community transmission going on in our state. We have different pockets that we have identified. As you're aware, on Monday, Dr. Mark Wilson of the Jefferson County Health Department issued health orders for Jefferson County, and on Tuesday, this department issued similar orders for 5 of the counties that surround Jefferson County. As part of the containment strategy, we are seeing increasing number of cases now in Lee County as well. And as I mentioned, we have a total of 68 so far from this morning. So to that end, I wanted to announce to you health orders that are being issued today by the State Health Officer with the Alabama Department of Public Health. Effective today, March 19th, 2020 at 5 p.m., all gatherings of 25 persons or more, or gatherings of any size that cannot maintain a 6-foot distance between persons, are prohibited throughout the state. This order shall apply to all gatherings, events, or activities that bring 25 or more persons in a single room or a single space at the same time. Effective today, March 19th, 2020 at 5 p.m., all beaches shall be closed. For purposes of this section, the term beach means the sandy shoreline area abutting the Gulf of Mexico, whether privately or publicly owned, including all beach access points. Effective Friday, March 20th, or actually at midnight tonight, all senior citizen center gatherings shall be closed. Senior citizen centers and their partners are urged to assure their clients continue to receive needed meals via curbside pickup or delivery. This is actually effective at midnight tonight so that these centers would not be in violation of the order when it is issued today. We wanted to allow them a time to take care of their clients today before discharging them. Effective at the close of the school or business day today, March 19th, all of the following shall be closed. All schools, public and private, including but not limited to elementary, secondary, post-secondary, technical, or specialty schools, and colleges and universities. This school closure order is not intended to prevent any employers from making continued necessary staffing decisions. Employers are authorized to advise employees to work from home or maintain flexible work schedules. Effective today, at the close of school day or business day today, all preschools and child care centers in the state are closed. This shall not apply to certain child care centers that are operated for the exclusive benefit of essential employees for certain categories of employers. This does not apply to child care centers that are caring for the children of essential employers for state and local governments, first responders, including EMS and fire services, law enforcement, hospitals, nursing home, long-term care facilities, including assisted living facilities and specialty care assisted living facilities, and end-stage renal disease treatment centers, as well as pharmacies and groceries. Effective immediately, all hospitals and nursing homes and long-term care facilities, including assisted living and specialty care assisted living facilities, shall prohibit visitation of all visitors and non-essential healthcare personnel, except for certain compassionate care situations, for example, end-of-life situations or maternity situations. Effective immediately, all elective dental and medical procedures shall be delayed. This is not a closure of offices for physicians or dentists or optometrists. Those offices remain open, and those professionals continue to care for their patients. They are still available to care for urgent and emergent situations, but all elective procedures shall be delayed. I would remind people that elective can be somewhat subjective. The CMS issued guidance last night that's available on their website about what could be considered an elective procedure. Effective today, March 19th at 5 p.m., all restaurants, bars, breweries, or similar establishments shall not permit on-premises consumption of food or drink. Such establishments may continue to offer food for takeout or delivery, provided that social distancing protocols, including maintaining a consistent 6-foot distance between persons, are followed. Such establishments are strongly encouraged to offer online ordering and curbside pickup. Hospital food service areas are excluded from this order, provided they have their own social distancing plan. I want to say we realize that certain bars, for example, or nightclubs may not serve food. This effectively serves as a closure order for them if they do not have food available for takeout. We regret that that became necessary, but that is the order effective at 5 p.m. today. There are some possibilities of obtaining an exemption from this order for the organizers or sponsors of certain suspended events. There's a mechanism within this health order for them to seek that exemption. A determination shall be made to whether to extend this order on everything that I've mentioned today sometime before April 6th, 2020. That's about 2.5 weeks away. These orders actually expire at midnight on Sunday, April 5th, and we'll make a further determination whether to extend them sometime before that. I want to say explicitly that there is authority for us to amend these orders at any time. We don't have to wait until that time. There may be additional exceptions that we have failed to consider or other situations that may change and cause us to need to amend this order, and we have the authority to do that at any time. These orders are issued for all 67 counties in the state, including Jefferson County and Mobile County. It's not the intent of this order to supersede any stronger actions that those health officers may wish to implement themselves. Dr. Mark Wilson in Jefferson County and Dr. Bert Eichel in Mobile County are the health officers for those counties, and they certainly have the ability to implement additional health orders, and we would almost certainly fully support them in that. At this time now, with our 68 cases, we have about 14 counties that have been involved. There's still 53 counties without a reported case so far. I think it's a fair question for Alabamians to ask why these orders should apply to them in those counties where we have not seen cases. I want to spend just a minute and explain what the rationale is behind extending these orders to the entire state. Our team and I have been looking at the best available data we can, literally almost day and night for the past couple of weeks. There are a few things in particular that I think are particularly worrisome for us. The first would be the example of what we have seen in Italy. Italy has the second most cases outside of China and easily has the second largest number of deaths. Italy now has over 3,000 deaths that have occurred in that country, all within the past 2 to 3 weeks. Italy is a modern European country with modern healthcare infrastructure, but has been slow to implement some of the distancing protocols that we are talking about enforcing today. Yesterday alone, in Italy, almost 500 deaths occurred on a single day, and this is very worrisome for us. We have taken some lessons from watching Washington State here in our own country. Washington State has had a very robust public health response and in fact has done an admirable job of trying to contain this outbreak, and yet they continue to see cases increasing and sometimes at an increasing rate. They are currently expecting their cases to double in that state about every 4 to 5 days, despite all the interventions they have seen so far. We know for a fact that many of their hospitals are in a crisis mode. They are exceeding their surge capacity. They are having difficulty handling the number of patients that they are able to see. 3 weeks ago, there were no deaths in the United States, not in Washington or anywhere else. Today, Washington State has more than 50 deaths. And so when we look at what is occurring in Washington State, we're worried about the situation that may occur elsewhere in the United States or in Alabama 3 weeks from now. This is such a fast-changing situation. We are aware of cases in our state now in certain situations, such as a school child, which was reported in the press, in a nursing home nurse, which was reported earlier today. A healthcare worker in a hospital who was infected was reported earlier in the week. I think I mentioned to you last time we were here. We know that we have local community transmission, and we know that we have vulnerable populations that need to be exposed. Additionally, we have learned that even though the elderly or seniors are the ones most at risk for serious disease, fully 40% of the hospitalizations are occurring in people that would be considered young adults or middle-aged as well. So even though the deaths may not necessarily occur in younger populations, those populations still have serious illness, many times requiring hospitalization. And so we know that this is a risk not only to our seniors, but to everyone. Finally, I would say that what we've learned about this virus is that when someone is exposed, symptoms may show up within a couple of days, but sometimes may take as long as 2 weeks to show up. So every single thing that we're doing today is not really going to affect the numbers we're going to see over the next 2 weeks. The people who are infected at this point are already infected, and we're going to see those numbers continue to increase over the next 2 weeks in spite of what we've implemented. What we hope is that the actions we're taking today will help to flatten the curve, as we've talked about, and try to reduce a transmission of disease after that. That said, I think it's important to be very clear and transparent with everyone. We've extended this health order through April 6th, and we'll make a determination prior to April 6th whether to extend it. I think it's certainly possible that it could be extended based on what we have seen in other parts of the country and other parts of the world. I think, in fact, it is likely. But we don't want to make that determination yet. We'll continue to watch the situation as it continues. I want to say that we fully acknowledge that we are imposing hardship on people. People have enough anxiety and fear already, and now we have health orders that undoubtedly are going to affect the lives of real people and the livelihoods of real people. It's a very difficult determination to try to get it just exactly right, to make sure that we're not overreacting, that we're not imposing a hardship, but at the same time trying to protect the health and safety of all Alabamians, which is our charge and our mission at ADPH. We are making the best decisions we can with the best available data that we can. We will know sometime down the road whether we got this right or not. If we have large numbers of cases that appear in our state, I think we'll wish we had done something sooner. If we have no cases in the state, I think we'll look like we overreacted to some extent. But I believe this is the safest course. It's the one based on the available data that we have, and I believe it's the best decision that we can make at this time. Finally, as I end my prepared remarks, I'd like to make a plea to the people in this state. Please pay attention to this. Please take this seriously. This virus is serious and can kill. It is particularly deadly for our seniors and for those people that have chronic health problems. We need to make sure that we are protecting our seniors. Even if you yourself are young and healthy and don't feel that you're at risk, you may be at risk of infecting or even taking the life of someone you know or someone you love, someone in your family or someone in your community. We don't want people to be afraid or anxious or worried. We want you to know that you actually have the power to protect yourself and the power to protect your own family. The social distancing things that we've discussed many times here, the hygiene things that we've discussed here many times before, are simple and straightforward, and anyone can do them, and we know that you can all do them. Not only can you protect yourself and protect your family, you are the only one who can protect yourself and protect your family. We do not have medicine. We do not have a vaccine. The way that we will get through this is by following these social distancing protocols and making sure that we isolate ourselves away from other people, wash our hands, stay home when we're sick, reach out for help when we need that, but try to do that in an appropriate way. That's all the prepared remarks that I have right now. We'll be happy to answer questions. I also have the other gentlemen on the stage here who can answer specific questions if you have them for them as well. Thank you. Yes.
How many of our cases have been people that have been hospitalized, and are we seeing any stress on ICUs, respirators, and what's our capacity there?
Yeah, I'm sorry, I don't know exactly how many have been hospitalized. Certainly, some of them, perhaps many of them. We have had conversations with many hospitals. Some of it is anecdotal, and I don't have numbers to give you, but we have absolutely been contacted by hospitals that are saying they're stressed in their capacity. One of the ways we respond to this is by activating a program called the Alabama Incident Management System. It's a computer program that links all the hospitals in the state. We've been doing that now for 2 or 3 weeks, and it keeps an up-to-date census in real time of available hospital beds and ICU beds and ventilators and even staffing to some degree, so that hospitals are able to share resources when they need them. I would say what's happened in Washington State shows that this has the real potential for stressing the surge capacity of hospitals, and certainly the concern that that could happen in Alabama is one of the reasons for issuing these orders today.
Dr. Harris, this is pretty dire news. What do you say to Alabama families that are trying to remain calm and stay safe?
I would say that in order to stay safe, it's actually really straightforward what we need to do. This is a disease that is not a serious illness in most people. More than 80% of people don't need to be hospitalized. The disease will resolve without any particular treatment and will resolve on its own. Even for those people who have to be hospitalized, most of the time they will recover fully and be able to go home and be healthy again. It's those most vulnerable populations that we're most worried about, the elderly and the people with chronic health problems. I want people to feel empowered that they have the ability to prevent this. They can protect their own family and protect themselves just by using social distancing and just by practicing good hygiene.
Dr. Harris, when you look at the situation in some of the more affected communities in the United States, has anything like a shelter-in-place protocol been discussed or thought about at this point?
I think certainly all public health agencies have discussed that as a possibility. It certainly would depend on a lot of factors and whether we saw ever increasing numbers in our community or not. There have been shelter-in-place protocols in a couple of places, as you know, and I would just say all public health agencies have considered that, but no plans for anything like that in Alabama.
Dr. Harris, could you walk us through our testing capacity? There seems to be growing anxiety about the test or lack thereof and the ability to test people across the state.
Sure. The testing rollout has kind of come in fits and starts. As you know, we initially had tests that were created by CDC and sent out to public health laboratories, but for a couple of weeks, states were not allowed to use them because of some questions about quality control. We finally began using them now around 2 weeks ago and have been able to maintain our testing capacity so far. In the meantime, there have been other testing companies or private labs that have introduced the ability to test as well, which has increased the number that we can have. I would say we're all a little bit stressed about obtaining materials, not only collection kits like the swabs that we use to screen a person at a site, sort of like a flu test, but also the types of chemicals and reagents that are used in the laboratory to actually run the test itself. There have been shortages of those nationally. We have not experienced a shortage to this point, but we're certainly concerned that that could happen. We have made every effort to reach out to suppliers and use our contacts in Washington and in the legislature here to try to get some leverage for supplying Alabama with that. That has been the main issue with standing up our screening sites around the state. As you know, we have several that have stood up already, but we have other places ready to go, and the rate limiting step has really been supplies. So that continues to be a challenge for us.
When do you think you will feel better about that? Because it seems like when we listen to the press conferences from the White House, these things are happening in days this week, but we're still not seeing it.
Yeah, I think that our federal partners have probably prioritized those parts of the country with the greatest outbreaks, and I certainly think that's appropriate for them to do. We continue to reach out to federal partners. We learned yesterday of a shipment of, for example, testing swabs that we're going to receive. We hope any minute, maybe already here, I hope. And we are having to go through a lot of different channels to try to piece together all the items that we need to make sure that we're able to test. So it's frankly, a laborious process. We have a lot of different people working a lot of different angles on that. So far, we've been able to keep up with that, but time will tell.
Do you think The lack of testing and the lack of confirmed cases may be giving Alabamians a false sense of hope here.
I would say that we want to be very clear-eyed about what's going on. We want Alabamians to understand that whether or not you have a test, whether or not the numbers in your state are high or low, there's no question that we do have transmission going on in the community. So I don't think people should have a false sense of hope, and I don't think people should be frightened either. I think people should understand the situation as it is. The way to prevent this is with social distancing. It's with good hygiene. It's staying home and staying out of public spaces, particularly if you're sick or if you're going to be around someone who's sick. And the testing is going to work itself out at some point. We certainly are hoping that it's sooner rather than later. But in fact, a single test for a person doesn't change the advice in most cases. People need to stay home and isolate themselves, whether they've had a test or not.
Dr. Harris, for those people that test positive or admitted to a hospital and treated and released, what is the protocol for them after they're released from medical care?
CDC has just recently issued some new guidance on this about whether additional testing is needed or whether you can wait a specific time period. We have shared that with our providers and with our hospitals. And for example, 2 negative tests after someone has been positive would be considered a cure, and someone would no longer be at risk and can be considered over the disease. Or someone who's had I think it's 3 days fever-free or 7 days after the onset of illness, whichever is longer, is the other criteria. Am I right about that, Don? Thank you. And so those are the criteria that we're currently using based on the best information we have.
Dr. Harris, for the people in Jefferson County and the surrounding counties, are the rules that you announced today for bars and restaurants, are those stricter than what they already had in place, or are those essentially the same? Or
for those counties, they're essentially the same. I have to remember what Dr. Wilson did in Jefferson County. I can't remember exactly, but they were almost exactly the same. And so the ones that for those counties have not changed, I believe, Mike. I think that's right. They're simply extended to the remainder of the state.
Is there any word on how many people have been tested in Alabama?
We're having trouble counting that number, but we have had hundreds in our state lab, between 500 and 1,000. I don't know exactly, but we know that the commercial labs are testing hundreds of people a day and have been doing so for at least the last week. So it would be a guess to tell you, but thousands of patients have been tested. At some point, we will collect all of these test results, positive or negative. That was actually part of our emergency health order that was issued a couple of weeks ago. But there's a little bit of just a logistical issue in getting those negative results in so that we can count them. We're getting the positive results, which we think are the ones that are most important, and we don't have any doubt about receiving those. But the negatives are a little bit more difficult to count right now.
Dr. Harris, you answered the question earlier about the shelter in place, but what about the possibility of a curfew here in Alabama?
There's really no discussion about doing that. I think it certainly depends on how well people understand the health order and understand the need to follow these orders that we have issued. To this point, not following our health orders has not been a concern, so we haven't really had any other discussions about curfew.
Could you
Dr.
speak?
Harris,
Yeah, I'm sorry.
the governor's order limits gatherings of 25 or so, but how does that relate to large-scale employers like call centers, production facilities? Does that relate to workplaces at all?
Yes, so we did not specifically address that for workplaces, but the order does apply to them. Workplaces will need to find a way to maintain social distancing, even if it involves having different, numbers of people spread across larger spaces or in a larger number of rooms than before. Gatherings of 25 or more are prohibited, and any gatherings are prohibited if they cannot maintain the appropriate distance. I've had discussion with a couple of you today. We clearly have work to do in this room with our press contingent, and I really don't mean that to be funny. We clearly, as of today, this gathering is one that we would have to schedule in a different way, and so we are working on a way to do that. We'll continue these sort of briefings to the press, live and publicly, and be able to take questions, but we need to find a different format so that we too are compliant with this. Yeah.
Could you speak to how the state is serving its rural population, especially with regard to testing and response?
Sure. Our rural population is a particularly vulnerable population in a lot of ways. You know, rural residents in Alabama actually tend to be older than urban residents on average, and rural populations tend to have more chronic disease on average than rural populations. So these are people that we absolutely want to make sure we are taking care of. The most important thing I can say is that we're trying to communicate that message to them that we've given about social distancing and hygiene. We had a terrific call with AARP in Alabama this morning that had hundreds of people attending a telephone town hall to try to get that message out. We certainly realize the struggles of health care in rural Alabama with rural hospital closings, with loss of providers, and that's really presented some challenges for us. We have made available, as you know, a toll-free number for people to call and find out where they can get testing if necessary, where they can be connected to a provider who can make them a determination about that. And so we're trying to use these electronic methods to make sure we can reach out and connect with them. It is a challenge, though. We have a state that has a moderate amount of uninsured people. We're not an expansion state. And so we have people that have some challenges, and we have them in the forefront of our mind and are trying to figure out how we can reach them, but it is difficult.
Can you talk about, Dr. Harris, can you talk about out-of-state people that may be coming in to get tested? Are they being counted as Alabama's numbers?
I'm only aware of a single case of that I know of. There could be others that I don't know, but one of our first cases that we found actually turned out to be someone who was from another state. And so just the way that health departments count their patients and count diseases in the country, there's just a standard understanding that you count your own residents and you don't count other residents. But you may remember our number when we first started getting results kind of dropped by one on the first or second day, and it was because it was an out-of-state resident, and so that was assigned to that state to their totals. I'm not aware if that's going on our large scale or at all otherwise.
I'm getting some questions in about the enforcement level of this order, particularly concerning the beaches. Could you talk about what would happen if someone just sort of disobeyed this or just ignored it?
Sure. Well, the attorneys can do a better job than me, but under state law, health orders that are issued by the State Committee of Public Health and the State Board of Health have the force of law, and breaking those health orders is a misdemeanor, I think, in most cases, and that person could be subject to a fine. I don't remember the exact numbers of that, but that's it is a misdemeanor. Right.
Dr. Harris, going back to employers, are employers required to report confirmed cases of COVID-19, and if so, to whom? The reporting requirements apply to laboratories and healthcare providers only, I think, but a confirmed case would only be confirmed if a lab was done to confirm that, based on our definition right now. So we have the way to pick those up. A private citizen or an employer would not be required to do it.
This may be a question for Dr. Williamson, but how many ICU beds and ventilators do we have in the state, and what is the concern about overwhelming that system? I know they can sometimes get stressed during a bad flu season.
Yeah, we've got 1,344 ventilators. On an average day, about 550 of them are in use. So we have a surge capacity of about 800. Now that's statewide. So you can have a situation where if you have a pocket of disease in a location, you can end up stressing that population, that location. Now, historically, we have, during H1N1, we actually moved ventilators among facilities to meet that surge demand. My assumption would be that we could do the same sort of thing here. But I think the greater concern that I've got is the experience of Washington. The challenge that Dr. Harris has is the actions of today can't be aimed at today's 68 cases. They have to be aimed at what is already infected that we're going to see 2 weeks from now. And so my concern is, while we may be as a system okay in terms of ventilators, I will not be surprised in the coming days to see isolated instances where we need to find ventilators, to move ventilators in. And then my big concern is as this tsunami approaches us in the coming weeks, that we are going to be challenged to have enough ventilators for the state at large. And that's a challenge not only in Italy, where they've had to make unbelievable decisions about who gets a ventilator and who doesn't. It's a decision that even in our own country, in Seattle, they're facing the challenge of not enough ventilators. So I am very concerned about, over the long haul, stressing our healthcare system. And that's why this social distancing is so very important. I mean, what we're trying to do, what Dr. Harris and everybody working on this is trying to do, is to flatten the curve for two reasons. Now, ideally, you'd like to reduce the number of cases, but there's no guarantee you can do that. But what you're trying to do is so that the surge on the healthcare system is never so great that you can't respond, so that you keep the demand low enough that you can actually continue to provide service. And secondly, or you buy time, so that new therapies, whether it's the new antivirals or, should the antimalarial drug actually turn out to work, those drugs have a chance to be available for people later in the epidemic that wouldn't be available if the epidemic is not managed correctly.
Are the ventilator numbers more important than the total ICU numbers?
Well, you can manage in some cases patients in something other than ICU as long as you have a way to ventilate them if their major need is ventilation. So what we sort of focused on at this point has been total number of beds and ventilators. And historically in Alabama, about 75% of the beds outside of the Birmingham area are occupied on any given day. So there's about a 25% surge capacity. And I think there are about 14,000 beds, if I'm remembering that number correctly. And in the Birmingham market, it's always around 90%. So they always have higher utilization. So as we're working with public health to look at, what's the stress on our hospitals, we're looking at beds and we're looking at ventilators.
All right. Any additional questions?
Dr. Harris, a question about quarantine. If an individual feels the need to self-quarantine, should that be 14 days from when their symptoms appear or when they've just gotten back from wherever they've traveled from? What would you advise in that regard?
Sure. I think it does matter whether that person has symptoms or doesn't have symptoms. My first response would be call your healthcare provider. That's where you get the best information. That's a person who can give you solid advice. And if there's one thing we've learned, the guidance we get is changing all the time. And so please talk to your healthcare provider to get the best possible advice. For people who have been asked to self-isolate because they've traveled from some place or because they've been exposed to a case, that is a 14-day self-isolation. In the case of someone who's actually sick, it would be those criteria I talked about earlier, depending on when they became sick or when their fever went away. But that would be a question for their healthcare provider during the course of that illness.
Dr. Harris,
Go ahead.
every few days, the guidelines for social distancing and so forth are stepped up, escalated, and gotten tighter. What's next? What could be another step the state would take if in the coming days if what you've done so far isn't sufficient?
Yeah, that's a great question. The numbers about gatherings, for example, have changed a little bit, and they're not the same from state to state, as you know, and we've gotten even different guidance this week from CDC based on what the president announced earlier this week. So some states say 25, and some say 10, and some say 50, and there are still some that say 250. The bottom line is really the distance you are away from other people, and that's so much more important than the actual number. So again, we're saying 25, but 24 people packed closely together is not okay, and 26 people, who are really spread apart, might be a different story. But really and truly, these guidelines that we have are sufficient. They are. What we need is the help of the public, the cooperation of the public, to make sure that these get carried out. We need everyone on board with this. We need people to take it seriously. We need them to understand that if they self-isolate, like we have asked them to do, we will get through this a lot quicker. We're going to get through this eventually sometime, no matter what. We know that, but we don't know how long it will be. But we know if people follow these guidelines as we've issued, we will get through this a lot sooner. And so we really plead with Alabamians to take this seriously and cooperate with these health orders.
Dr. Harris, I'm getting a question about, people are concerned about hair salons and if this will affect them or even, I guess, nail shops.
Sure, those are great questions. We have been talking with the licensing bodies for those facilities and have guidelines that have issued for that. I think the point is to look at our health order, which says gatherings of any size are not permitted if people cannot maintain the 6-foot distance. So that statement answers a lot of those questions about specific situations. We want people who are in groups to maintain that 6-foot distance, and if they're not able to do that, then those gatherings are not allowed.
Dr. Harris, when it comes to condominium and apartment pools, with it being spring break and people starting to get cabin fever, if they start to kind of congregate around those spaces and gather, who's going to enforce the rules of more than 10 or whatever the number may be, and how is there going to be some sort of handle on that?
Yeah. That's a great question. Look, we need the public to buy in and cooperate with this. There are enforcement powers that the state of Alabama has, and there's a way to do that in a coercive way, although, it's really difficult to find every single instance of someone violating these orders. The way that we're going to be successful with this is to get people to understand the seriousness of this, to understand that their own actions affect other people, and for them to realize that social distancing is important for everyone. It's not just for them, but it's also for their parents and their grandparents and their loved ones and for people in their community. We have issued orders that are designed to compel people, but that's not what we need. We need people to cooperate. We need people to take it seriously and follow these. Any additional questions? Okay. Thank you very much for joining us. We will continue to have regular updates for you. We're still working out what the schedule of that will be. I think there's a statement that may have been circulated that you may want to take before you go. Please reach out to us if you have additional questions, and we'll speak with you again soon. Thank you for